everyone, it's Dr. Nikki, the board certified family nurse practitioner back in the house. I hope you're all well and you're staying safe. Into this new episode, I will be talking about arthritis. So we do have different types of arthritis, but we will focus on OA, which is osteoarthritis, and RA, which is rheumatoid arthritis today. So RA and OA. Let us get started. So we're going to be talking about the similarities and the differences between OA and RA today. One thing that I want you to note is that RA is an autoimmune disorder. RA is an autoimmune disorder, which means that your body is attacking itself. On the other hand, OA, which is osteoarthritis, is a degenerative disorder. All right, so it's autoimmune disorder versus degenerative disorder. So that's a key difference. Autoimmune for RA, degenerative for OA. All right, so we're going to talk about the similarities, as I said, and the differences between RA and OA. And OA is the most common form of arthritis. It's a degenerative joint disorder, as I mentioned before. With OA, a lot of people will experience breakdown of the cartilage. So cartilage between joints, all right? So think of it as a cushion between joints that breaks down or wears down. All right, so experience a breakdown in the cartilage that cushions the joints, so it will make the bones of the joints rub against each other, and it exposes the small nerves and all that, and that causes a lot of pain. All right, so OA is not an autoimmune disorder. RA is. Okay, so risk factors. Both types of arthritis are very common in women than in men. All right, so OA is more prevalent in older adults, and RA can develop at any age. All right, RA can run in families, so you have a higher chance of developing the condition if you have a family member that has it, such as a sibling or parent. You have a higher chance of developing the condition if you have a family history of RA. All right, so who are the people that are more likely to develop OA, which is osteoarthritis? So if you have diabetes, if you have gout, if you have joint deformities, if you're overweight, or if you've experienced any kind of traumatic injuries to your joints, you are at risk of having or developing OA, which is osteoarthritis. All right. So what are the similarities and differences between RA and OA? So basically, some of the symptoms are the same, and they include painful, stiff joints. So one other thing that we've seen with RA and OA is that OA, you have morning stiffness. For osteoarthritis, morning stiffness, and then when you get up and move around, less than 30 minutes, you're fine, your joints are okay. But for RA, it may take longer than 30 minutes, maybe an hour, for you to get your joints working well. All right, so morning stiffness and is one other thing that you should note for between RA and OA. All right, so we have painful, stiff joints, we have limited range of motion, we have warmth or tenderness in the affected area, and then we have increased intensity of symptoms first thing in the morning. That's why I said morning stiffness. Some people with OA, cold weather aggravates the pain. When it gets cold, the pain is more intense, and then when it gets warm, they're much better. All right, and the characteristics of OA. All right, as I said before, each kind of arthritis has its own unique set of symptoms. Okay, RA is an autoimmune disorder, and it means that it can affect any part of your body. It can affect your entire body. It can affect your lungs, your heart, your eyes. It can affect your joints. It can affect anywhere. So that's the difference again between RA and OA. OA will mainly affect your joints, but then RA can affect any part of your body. So early signs of rheumatoid arthritis would include excessive fatigue, muscle ache, and low-grade fever, especially in children. Right? And then people with advanced stages of RA may notice hard lumps beneath the skin near the joints. The lumps are called rheumatoid nodules, and they can be very tender. All right, so that is for RA. For OA, all right, people with OA, sometimes they don't, they're unlikely to experience overall symptoms, as I said before, because it's limited solely to the joints. So you may develop lumps under your skin, around joints. So I've seen a lot of people with OA, osteoarthritis, with deformity in their finger joints. They have these lumps under the skin around their joints, but these lumps are different from rheumatoid nodules. All right, so people with OA tend to develop bone spurs or excessive bone growth at the edges of the affected joints. All right, so yeah, and then for RA and OA, the joints that are affected are kind of different. All right, so for RA, usually begins in the smaller joints. As I said, stiffness, pain, swelling in the finger joints, and then as it progresses, it can develop in larger joints such as the shoulders, the ankles, and the knees. That is for RA. As I said, RA is an autoimmune disorder, and so it can affect any part of your body. But for OA, which is osteoarthritis, it's less symmetrical. So that's another difference between RA and OA. So RA is a symmetrical disease, meaning that it would affect both sides of your body at the same time. All right, it would affect both sides of your body at the same time. So right, left, like that. But OA, it doesn't necessarily have to affect both sides of your body. It's less symmetrical. You can have arthritis in your left hip and don't have it in your right hip. You can have it in your right knee and not have it in your left knee. All right, so it's less symmetrical in OA, osteoarthritis, and more symmetrical in RA, rheumatoid arthritis. So yeah, you can have pain in your right knee, left hip. It doesn't have to be the same for RA. All right, it doesn't have to be both sides. And then OA, osteoarthritis is common in the hand and finger joints. It can also affect the spine, hips, in addition to the knee. So a lot of people with OA will complain about back pain, finger, hands, wrists, spine, hips, and those kind of joints. That's for RA. All right, as I said before, when the RA is so intense and unbearable, some people have to go for cortisone shots to help relieve the pain. All right. Okay, so what do you do for treatment? What do you do for treatment? So the primary goal in treating both of these conditions is just to improve function and to minimize damage to the joints and also to reduce pain. That's very important, to reduce inflammation, reduce pain, improve function, so that you can carry out your activities of daily living. All right, some people, they have pain so bad that they cannot even do things that they used to do before. They cannot take care of themselves very well, to even brush their teeth, take their bath. It's kind of very serious for some people, and so they need help. Some people will even tell you, people with OA, osteoarthritis, will tell you that they can't open jars anymore. They want to open a jar of food or any kind of container. It takes all their effort to try to open it up because of the arthritis that they have in their finger joints. All right, so as I said before, the primary goal of treating OA and RA is to reduce pain, improve function, and minimize damages to your joints. All right, so your healthcare provider may treat this differently, and they may also send you to a specialist who can help you. So we have rheumatologists that can help manage this condition for people that need it. Okay. All right, so as I said, some people get cortisone shots. Anti-inflammatory medications can be taken, like NSAIDs, non-steroidal anti-inflammatory medications like NSAIDs. You should please try to follow the directions of those medications. Do not take them on empty stomach, and do not take them long term if you can. right? Because it might cause GI bleeding and all that. So try and eat before you take your medication, and you will be okay. And try not to take them long term. All right, so as I said before, corticosteroids and medication can be given, anti-inflammatory medications, which is NSAIDs, non-steroidal anti-inflammatory drugs, and like ibuprofen, Motrin. All right, and then they can be generally effective for both RA and OA. All right, if you have RA, there are medications that may be given to you that will suppress your immune system, so that you can prevent damage by stopping your body from attacking your joints, because that's what is happening. Remember, I said RA is an autoimmune disorder, so there are many medications out there that can suppress your immune system and prevent the damage. So for RA, people take medication. All right, there's no cure though for RA and OA, but symptom management, treating symptoms is a goal, and you want to just manage the symptom of both conditions very well. All right, so please contact your healthcare provider if you feel like you are experiencing symptoms of RA or OA, so that it can refer you to a specialist to help manage your condition and treatment as needed. All right, so that is all I have for you regarding OA and RA today. I hope now that you understand the differences between and the similarities between RA and OA, that RA is an autoimmune disorder, which means that body is attacking itself, and OA is a degenerative disorder, and it's when the cartilage wears down, right? Can cause the bones to rub against each other. So exercise is recommended. Even though you're in a lot of pain, you still want to exercise and move your joints. I tell people, try and exercise, walk around, just get your joints moving, and it helps a lot. So exercise when you do have either RA or OA. Physical activity of some sort is what is recommended, and is by far the most important form of treatment so far. All right, even though it causes pain, it would help you a lot. So as I said, please, if you need any special education about any type of exercise program that you should be doing, let your healthcare provider know about it. And then remember that you can talk to your doctor about treatment options for your RA or OA. And then please check in with your mental health, because a lot of people that have RA and OA, they may suffer from depression because of the deliberate, the way that the disease has affected them. So remember, it can take a toll on you. So please make sure that your mental health is good, and make sure that you seek help when you need it. So please follow up with your healthcare provider, follow up with your specialist, so that it can treat you appropriately for your arthritis that you have. All right, so I hope this helps, and I will catch you in the next one. Please share this episode with friends and family. Another thing that I wanted to say is that you can actually use a clinical assessment, or when you go in to see your doctor, they can easily diagnose arthritis, by looking at the symptoms and the deformity and all that. But for rheumatoid arthritis, they may do a blood test for you to confirm that diagnosis. Blood tests, X-rays are used to confirm the diagnosis. All right. So as I said, they can when you go in for your physical examination or appointment, they will ask you a lot of questions about your medical history, and then they may use blood tests and X-rays to confirm the diagnosis. All right, and then they may send you to physical therapy to help. And if any of the treatment options does not work, surgery may be required for people that have OA. So if you have really bad arthritis, osteoarthritis in your joints, and they've exhausted, treatment with NSAIDs, treatment with, exercise, treatment with cortisone shots and pain medication, and you still have intense pain, then surgery may be needed for you. So talk to your doctor about that, and let them guide you into the right treatment. All right, thank you so much. I will catch you in the next one. Continue to stay safe and be well. Bye bye.